my name is Miranda Kelly, and I'm a nursing student at Nightingale College, and this is my pulse check assessment number 1 for PN 126. To start off, I'm going to gather supplies, make sure I have a stethoscope, pen light, my pen light here, coffee for smelling, and my Snellen chart, which is in the back over there, and clean gloves and stuff to clean my stethoscope with. So after gathering supplies, I'm then going to come in. I'm going to close the door or curtain and do hand hygiene. Hello, my name is Miranda, and I'm your nurse today. Can you tell me your name and last name?
Chance Weaver.
And your birthday?
10/5/85.
Okay, I've now properly identified my patient using 2 identifiers. We're going to be doing a little assessment, kind of checking some of the cranial nerves, looking at your skin, and doing a full set of vitals. If you have any comments or concerns at any time, you can stop me and we can address those. Thank you. Do you have any pain right now?
No.
I'm going to ask you a couple questions that might seem silly. Can you tell me where you are?
At home.
Can you tell me what day it is?
The 24th.
Can you tell me what we're doing?
A nursing video.
Okay, so my patient is ANO times 4. So alert and oriented times person, place, time, and event. And then also while they're talking to me, I'm going to note the general appearance is well kept. Hygiene is also kept up. Patient does appear to be tired, which is understandable for the time of day, so no abnormal finding there. Mood also kind of goes along with the tired. And then we asked about pain. Do you have any allergies?
No.
No? Okay. I'm going to get on my pair of gloves here and we'll start the assessment. So first I'm going to get a full set of vitals. So my temp is 97.5 tympanic is how I would chart it. Pulse, counting over a minute, I got 80 beats per minute. Regular rate, 2+ on radial. And then respirations, I would count over a minute, 16 respirations. No abnormal patterns of breathing per minute. And then blood pressure, we take blood pressure. 120/80 is how I would document it for blood pressure. And then I would want an SpO2 on the finger, 97%. And then after getting a full set of vitals, I'm going to be looking just a general appearance of your skin. I do see a bug bite here. We do have 2 tattoos on the forearms. I'm not seeing any other, no other lacerations, no any other deformities. On the top of the skull, I do have a little bit of hair thinning on top, but otherwise the hair looks healthy, no flaking or scaling in the hair. And then we'd want to note skin is warm, skin moisture is dry, and skin color is pink, and there's no skin turgor. Then moving on, I'm going to note symmetry of the eyes, proportionate to the face. Same with the ears, bilateral, they're proportionate to the face. I'm going to look at the mouth. Mouth appears to have no cracks, or they're pink and moist, or no lesions or anything on the mouth. Can you go ahead and stick your tongue out and say ah? So that cranial nerve is intact, and I'm going to look at the mucosa. Moist in the mouth. Palate is also intact. Can you clench your teeth? Okay, so that cranial nerve is intact. We would also note a couple of teeth missing. We'd want to note. And then moving on to the nose, or let's do the ears. So I don't see any drainage or foreign objects in the ears, right and left. And then with nose, no drainage in the nose. Can you cover one and pat and see The left side is patent, right side is patent. And then let's look at, so the eyes, the sclera, and the conjunctiva. So sclera is white, conjunctiva is pink. And then we're going to check your cranial nerve by shining a bright liner. Look at my nose. And both eyes are 3 millimeters bilateral. Can you raise your eyebrows? That cranial nerve is also intact. Can you shrug against me pushing down? Okay, that cranial nerve is intact. Inspecting the neck, I don't see any JVD or tracheal deviation. No pulsating of the pulses in the neck, and no lip noise in the neck. Oh, yes. Let's do the 6 cardinal fields of gaze. So I'm just gonna keep your head still, follow my light, or follow my pen light. No bouncing of the pupil, and all gazes are intact. Then we would, I don't know if I noted, cap refill is less than 2 seconds. While looking down here, the nails all appear round in shape and well kept. And then we would want to check cranial nerve 1. Can you smell that?
Mm-hmm.
Awesome. Okay, so cranial nerve 1 is intact. And then we would want to check vision using the Snellen chart. I don't have 20 feet of room to be able to check properly, but what I would do is I'd have my patient 20 feet away from the chart, and they would say the smallest number that they can read accurately, we would note, using both visions, and then covering one eye and then covering the other. And the way I would document that would be my patient is 20/20 vision in both eyes, 20/20 vision in right eye, 20/20 vision left eye, and they're uncorrected. That's how I document that. And then assessment wise, I think I have completed my assessment. Do you have any questions for me?
I don't.
Okay, thank you. I'm gonna make sure you're comfortable. Give you the call light here. There you go. Make sure that they don't need anything else from me. And take my gloves off and put them in the basket. Perform hand hygiene, and then document my findings.